Recently, many states in Nigeria experienced an outbreak of cholera, and it is no doubt a major concern to government and other stakeholders as cases are still on the increase. Reports indicate that many persons lost their lives this week in Katsina State. So far, health personnel and drugs have been sent to the affected areas, while public sensitization campaigns on water sanitation and personal hygiene have been intensified. Cholera is a waterborne bacterial infection that affects the intestinal tract and is characterized by vomiting, watery stool, dehydration, and fatigue. It can be transmitted by flies when they come in contact with food and can be fatal if not treated on time. Some states in Nigeria have reported suspected cholera cases this year. According to the Nigeria Center for Disease Control (NCDC), Benue, Delta, Zamfara, Gombe, Kebbi, Kwara, Plateau, Kaduna, Kano, Bayelsa, FCT, Sokoto, Nasarawa, Kogi, and of course now Katsina, have some cases of the disease. And data indicates that thousands are suspected to have the disease, with hundreds of deaths reported in those states. Since January, more than half of the confirmed cases are children and teenagers between the age of 5 and 14. What are the real statistics in the affected states? What are some of the causes of cholera? What exactly is government doing or expected to do? What should be the role of people? And is cholera contagious? Well, these are some questions that the program will find answers to today. Welcome to Nigeria Today. I am Anne Jibono. Now, joining me to speak on cholera outbreak in Nigeria is Dr. Isaac Eboja. He's a public health specialist. Welcome to Nigeria Today.
Good evening.
Recently, we've heard of many states, like the intro said, many states have cases of cholera. Recently, just this week, Katsina reported so many deaths. What's really the challenge? What's your take on the statistics so far?
Well, we don't have any reason to doubt the figures that that are being reported. The real problem is this. During this time of the year, there is flooding everywhere in many states. The number of states reported now is about 18. That is half of the number of states in this country. And when we have a situation where in many states there is open defecation in almost all the states, and when there is flooding or when there is rainfall, there is contamination of water, surface water. Even water in the world is also contaminated because of flooding and because of running water. And many of our states, if not all, have not been able to achieve what we want to have in terms of sanitation, in terms of toilets for people in the villages, in the towns, in the public places, and so on and so forth. And it is worse during the rainy season because when rain falls and people defecate outside, the feces are carried all over the place, and this is where the bacteria is harbored. So when you get when you drink the water that is contaminated, then you get the bacteria. And when you also eat food that is contaminated by dirty water or food that is taken from the soil or taken in an environment that has already been contaminated, and you don't wash it and you eat it, or you don't boil it and you eat it, then you stand a chance of getting infected.
Just how serious is this challenge, this issue in Nigeria?
It is serious.
The figures and data you have been able to lay your hands on.
Yes, it is serious. Serious because cholera has been reoccurring almost every year. Almost every year. There are some states that there's nearly any year where they don't have cholera. And if they don't have for a few years, it comes back again. So it's a big challenge for us. You recall that The Sustainable Development Goals that the United Nations is implementing in conjunction with many countries, including our own country, emphasizes on clean water and environmental sanitation. In fact, the goal number 6 of the 17 Sustainable Development Goals emphasizes on clean water and sanitation. And our government, along with many other governments, are working to make sure that among other goals, this particular goal is achieved. And until we achieve it, we may be having this problem.
Okay, now beyond, you mentioned open defecation. Can indiscriminate dumping of refuse also, lead to cholera?
Of course, if the refuse contains feces.
Okay, so it's
it's the same thing.
It's
But what is important is this: in places where people have been affected, the water has been contaminated, or in homes where there have been some cases, special attention have to be paid to those who have been affected and those who have not been affected. What do I mean by that? Those who have been affected should be kept aside. They should be washed properly. They should make sure that they don't drink dirty water, contaminated water. They should receive treatment as quickly as possible. When you are vomiting, you are also stooling, you are likely to be dehydrated. And in fact, this is one of the causes of death that have been recorded, dehydration. But the problem is this: if somebody is dehydrated and you rehydrate the person, you give the person contaminated water, you're not done any good. You're only prolonging the time that the person may give up. The person will still be infected.
So what should people do?
Water should be boiled in those environments, in those states, in those local governments where there is cholera and there is no potable water. The most important thing to do is to boil the water that they are drinking.
All right. Just how contagious is cholera?
When you say contagious, if I have cholera and you just touch my body, you will not get cholera by touching me. However, if I am vomiting and it is all over me, say for example I'm a child, a 3-year-old, and my mother comes around, takes me, when my body is contaminated, her hands are contaminated, and she goes and eats or goes and touches food that somebody else is going to eat without washing her hands, she's carrying it from me to the other person or to herself. So those who are looking after these people in homes have to be careful themselves. But the advice is this: if somebody comes down with cholera, try to get a health caregiver from a hospital, from a healthcare center, from any health facility to look after the person. Don't try to solve the problem at home. You may try to resolve the immediate problem of vomiting and weakness and so on, but that's not the solution. The solution should be given at a healthcare facility.
So it means it's treatable?
Yes, it's treatable. Yes, if you take the person to the hospital or to a clinic or to a dispensary or to where they have the medication to give, the person will recover.
Well, let's understand why the death rate is so high. The figures are alarming, and we notice that it's mostly between children age 5, teenagers, between children age 5 up to teenagers and on age 14.
Yes.
So why is it because of their age, or is there any other reason?
Yes, children are vulnerable to acute diarrhea generally. And when they have this kind of case where they are vomiting and they are passing stool and they are dehydrated and they are not well taken care of immediately, they are more prone to have more serious problem and to die than an adult, for example. But over and above that, if you are a Nigerian and you live in the village You know what happens during this time of the year? When it rains, many children go out to play. In fact, they take rain as an opportunity for them to play. They play in the rain, they jump, they swim, they drink the water from all sources. And like I said, during this time of the year, when there is flooding, when there is rainfall generally, and the sources of water are contaminated, the people who drink those contaminated water first and most are children. They are children, and they are the people that are also most vulnerable.
So it means every time we get into the rainy season, this occurs.
Well,
Was this year a special case?
No, it's not special. This has been happening. If you notice, last year, the few cases that were reported, it was about this time of the year too, last year. So it is not just peculiar to this year. The issue is this: as long as we don't have potable water and we don't have good sanitation, when I mean good sanitation, I mean environmental sanitation, including toilets, where people should go and defecate, and not outside, and not where the feces will be contaminated, the drinking water will be contaminated with feces. This is very key. And the two of them are related. Clean water, clean environment are related to each other.
Okay, let's look at the best options before state actors now. At this time, so many states are involved in this. What are the best options before government, and with what's been done so far, what advice can you offer at this point?
Yes, for those states that are already experiencing cholera epidemic, they should make sure that they go out to educate people. Health education is very important. Sensitization is very important. Mobilization of health staff to those areas is very important. Making sure that the affected patients are treated as quickly as possible is very important. And if they don't have the things that they need to treat these patients, they should request as soon as possible. If one state does not have, that state should go to the next state that has and get some, or at least cry out to the federal government to support them. But every state should take care of its own case as soon as possible. The issue of let's wait and hear more, or let's wait and hear more and get more figures, is not a good news. Because by the time you get there, many of the affected people may have been dehydrated and would go into coma and die. So the earlier, the better. That's one. Two, that is for treatment. Then, in terms of prevention, we should do as much as we can to provide potable, drinkable water at this time of the year, and especially in affected areas. The water can be treated with chlorine. The water that is already contaminated can be boiled and cooled for drinking. Those are measures that can be taken at home and in health facilities where they need water, and where there's a possibility of contamination of sources of water. That is very important. If you live in a village, like I have lived in a village, you discover that sometimes along the streams, they dig around the streams where they fetched water to go home and drink. And when there is flooding, those sources of water are contaminated because the water that flows along the stream channel now overflows and goes and contaminates the sources of the areas where they dig and where they normally fetch water for drinking. So, and there's no way you can look at water and tell whether it has been contaminated. So my advice is that whatever water they are drinking, let it be boiled, or let it at least be treated with chlorine.
All right, let's pause for now and take a break. Nigeria Today is taking a look at the outbreak of cholera in parts of the country. The program returns in a moment. Thanks for staying with us. This is Nigeria Today, and we are discussing cholera outbreak in the country. And our guest is still here, Isaac Ebojai, public health specialist. Now, let's look at the Sustainable Development Goals. Do you see states keying into these SDGs as a way out of some of these challenges, a challenge like cholera, for instance? Or how can the SDGs help in addressing these outbreaks?
Okay, let me give a history. In the 80s, we had what we call the mid-decade goals. That was aiming at achieving certain things. There were about 5 goals at that time, mid-decade goals in the 80s. And unfortunately, many states, many countries did not achieve them. Then the United Nations, in collaboration with countries, then came up with Millennium Development Goals. And there were 8 of them. This was part of them too. Clean water and sanitation was part of it too. And we were not able to achieve them, the goals. Many countries tried. Some achieved some of the goals and not others. In this country, we almost did very well in some of the goals. But in some of them, we didn't do as good as we should have. Then now we have, when they reviewed what happened during the mid-decade goals and found that many countries were lacking, were unable to achieve the goals, they then said, okay, let's try. We're going to have the end of the millennium soon. So they said, okay, let's go for the Millennium Development Goals, meaning that during this millennium, let's have goals that we should achieve universally, that's globally. Then they passed the information around to countries, and every country was supposed to do its own part, especially developing countries like ours. And unfortunately, we were not able to achieve the goals, like I said. Then, during the review of that, came the Sustainable Development Goals. And it is hoped that by the year 2030, these goals should be achieved. We are now in the year 2021, and we are not far from it. You may say 9 years is a lot of time. 9 years is not a lot of time. It will come very quickly. And what has happened? Many countries are taking it seriously and they are doing very well. Some are not doing that much well. Some countries are doing very well in achieving some of the goals, but they are lacking or they are unable to achieve as much in some other goals. In our own country here, there is a lot of effort that is being made by the federal government. I'm aware of that. How much states are complementing is what I cannot say. And I'm not sure there's anybody who can say, I'm sure that every state is complementing the effort of the United Nations and the federal government in implementing the Sustainable Development Goals. Because the stride in every state is different. And because health is on a concurrent list, some states relax and feel, well, the federal government can do this, or the federal government will give us assistance to do this. Some states are always waiting for the federal government to give them assistance or to kick them to move or to do something. Whereas they should be the one to start. As a matter of fact, this issue should be handled from the local government, especially for health, from the local government to the state, from the state to the federal government. The federal government is only supposed to provide the policies, the guidance, and monitor what is going on nationally.
In other words, the states,
should be the ones implementing, along with the local governments. So your question about how many and whether the states are doing well or not, well, one of the answers to your question is what we are seeing now. If we are doing as good as we should do, we should not be having the type of statistics that we're having with cholera, for example. If we were to be having potable water, what I mean potable water, I mean treated water in homes, and people are drinking safe potable water, we will not be worried about cholera. If people are not doing open defecation and they have toilets, at least 90%, for example, of the people, we will not be having these kind of cases and figures that we are having. We may still, if 90%, for example, we may still have cases here and there and once in a while, but they should not be as alarming as we are having now. So my advice is this. If the federal government is providing policies and guidance and guidance to the states should be implementing and monitoring themselves and be more active and proactive in terms of preventing some of these problems that we have.
How about non-state actors like the private sector?
Yes, yes. NGOs are also, let me not forget them.
Very briefly.
Apart from United Nations agencies like WHO, UNICEF, that are helping in every country, especially in our own country here, they are working with the federal government. NGOs are also working, and I know of a lot of NGOs in Nigeria that are providing drinkable water. They are providing
so why are we
boreholes.
Having these figures? Why are we still having these figures?
They are doing something, but they are not doing enough.
All right.
That you do something does not mean that you have enough. If you are hungry and you take a bite, a little bite of a piece of bread, that does not satisfy you, and that does not prevent you from getting hungry.
So now, beyond the efforts of government and non-state actors and all that, what should traditional rulers, community leaders, the citizenry, what should they be doing to prevent this kind of outbreak in the first place?
Very good question.
They're alive.
Very good question. No matter what state governments do, what the federal government does, what the local governments do, they can never solve all the problems unless those people who are recipients are themselves participating in resolving or solving the problems. They should make sure, for example, that they dig latrines. You don't have to wait for the government to come and dig a latrine for you. You can do this by yourself. You don't have to wait for the government to provide you a borehole if you can afford it. And if you cannot afford it and you are fetching water from the streams, then you should boil your water. These are some of the things that we can do. Keep our environment clean, keep ourselves clean. If a person is infected with cholera, for example, you make sure that the person is washed, the clothes are washed, the place is disinfected, the place is taken to a health caregiver. And there's no chance of somebody keeping the person at home with the hope that they can solve the problem. This is not an issue for home. It's an issue that should be treated in a healthcare facility.
All right. Thank you very much, Dr. Isaac Egboja, for joining us today.
You're welcome.
Public health specialist.
My pleasure, any day,
yes,
anytime.
Certainly a pleasure having you on the program. And we also thank you for sharing your time with us today. Nigeria Today is live every weekday at 7:30 in the evening. Or you can watch this and other editions on www.youtube.com/NTA News 24 Hub. I am Anne Jibuno.